Nicole, and floor is yours. Thank you.
Awesome. So I am going to drop in the chat really quickly our interview and survey protocol that we are working on for this project. I think I'm going to do that. We'll see if it works. And then I will start the presentation as well. Is this going to let me do it? Maybe. We'll do the presentation first because it's not working. So we'll do that first. Sorry about this. Just give me one moment. Okay. So like I had said just a moment ago, I am, let's see. So I'm a second year doctoral student at the University of Cincinnati, and this is one of the projects that I'll be working on in the upcoming year. So we've entitled this project A National Portrait of Trauma-Informed Practices in Juvenile Detention Facilities. And so I'm working on this with Valerie, and then we have an undergrad student who's working really hard with us too. Her name's Lily, and then Chris and a couple other people from our team are also helping out with this project. Okay, so we'll first just talk about youth in detention facilities and kind of what this looks like in America. And so, as you can see, there's about 48,000 youth that are held in facilities away from their homes. And so this can be that they're in long-term facilities and residential programs, group homes. Some of them are actually transferred into the adult prison system, but a big chunk of them really are in detention centers. So we have about 16,000 youth that are detained in juvenile facilities, and usually what makes up this kind of detained youth is that they're awaiting a hearing, a sentence, or placement, and it's meant to be really short term. Ideally, detention centers are for serious and violent youth, but we see that a lot of low-level offenders are actually held there as well. And so as you can kind of see on this little chart on the side, while we have a decent chunk of them that have committed person offenses, which usually end up making up those more violent offenses, there's definitely youth that have committed status offenses, which means it's only illegal because they are under a certain age, usually 18 or 21. Technical violations of their probation, so they wouldn't have actually been charged with a crime or an offense unless, like, if they were not on probation. And then we've got some public order, drug, and property. So we definitely have some low-level offending youth there. And then we do know that boys make up a greater number of youth in the system, but as we've been seeing we've been seeing fewer youth overall in the juvenile justice system and in detention centers. But what we're seeing is that boys are kind of decreasing and girls are either staying the same or increasing. And so while boys are still making up a greater number, girls are actually increasing in the proportion of youth that are in detention facilities. Next. So a lot of youth have experienced trauma prior to coming into the juvenile justice system. This is true of people, whether they're in the juvenile system or in the adult system. But what we refer to this as typically is the victim offender overlap, or the cycle of violence or cycle of abuse. And the whole idea here is that these individuals are not just offenders, but they often have victimization histories as well. So it can be anywhere, I've seen numbers from anywhere from like 60 to 90% of youth that are in the juvenile justice system have been victims of community violence, of sexual violence, of physical violence. And these are happening oftentimes prior to coming into the justice system, but also can occur while they're in the justice system. So a lot of research on trauma-informed care kind of comes out of, and trauma in general kind of comes out of this ACEs research. And so it really started with Dr. Felitti, and he pioneered this incredible study that basically looked at, they surveyed a bunch of adults and asked about 7 different types of abuse and neglect and just adverse childhood experiences that they potentially had experienced in childhood. And they linked these to health outcomes. So they looked at a lot of like, cancer, hypertension, any like smoking related outcomes, drug use, all those types of things. They looked at obesity. And recently, a lot of this research on adverse childhood experiences has indicated that these adverse childhood experiences can also be linked to issues that are more behavioral in nature, so justice-related outcomes. So what they've found with this research is that about 70 to 90% of youth have been exposed to some type of trauma. And there are 10 different types of ACEs now. So we expanded from those 7 to those 10 now. And that could be physical, emotional, or sexual abuse. Physical or emotional neglect. And then there's also these household dysfunction characteristics where you're living with a parent or guardian who has a mental illness, you have an incarcerated relative, your mother was treated violently, so this exposure to domestic violence, right, you're witnessing violence, and then substance use or divorce. And what we've kind of found is that the more types of ACEs that youth are exposed to, the greater likelihood that they will be engaged in deviant behavior, engaging in substance use, engaging in violence, and come into the juvenile justice system. And so because we know that there's this huge proportion of youth that have been exposed to trauma in the system, we need to know how to respond, right? And so trauma-informed care kind of comes in as an intervention, but really as just this framework, this way of thinking differently about how we want to address youth in the system. So there are 4 R's of trauma-informed care. This is from the Substance Abuse and Mental Health Services Administration. So SAMHSA has done a ton of work. They've really tried to operationalize a lot of, okay, what does trauma-informed care actually look like? What do these practices look like? What are the principles? But the 4 R's are really just that we are realizing that this trauma has likely happened to a lot of people, right? And that's not just in the juvenile justice system. This is everyone we encounter. You don't know who you could encounter that has been through trauma. But specifically for the juvenile justice context, right, that these youth that we label as deviant and as offenders have also been victims and have been through some sort of trauma. And then we go into recognizing, and that's not just recognizing like the signs and the symptoms and knowing, okay, yeah, this could have happened, but understanding really the signs and symptoms of trauma. So symptoms of trauma can be wide and varied, and they really differ from person to person, but this could be something like running away. That's what we see really commonly with girls, is that they're in a home environment that is so toxic that they end up running away because that's their escape from it. We would normally label this behavior as deviant and delinquent, and they get in trouble, they come into the juvenile justice system. But actually that could be a trauma response. We could also see things like sleeping a lot, being defiant. We really, especially in corrections, right, we rely a lot on order, and that those who are incarcerated need to respect correctional officers, but it might be really difficult for someone who's been through trauma and has had people in these positions of authority. It's hard to respect them. It's hard to really be respectful towards them. So they might be defiant. It might just be that they're gonna kind of push the boundaries a little bit. It could also be substance use. That is a really common a really common trauma response. And so making sure that we're also treating those behaviors and understanding that this is coming from a place of trauma, not from a place of, this is a bad kid and we need to punish them. And then that kind of leads into this response. So at this point, we're really integrating all of the knowledge that we have, and kind of understanding that because of this trauma that has occurred, we need to respond differently. That usually means taking a less punitive approach. It means being a lot more compassionate, and we'll kind of go into what trauma-informed care responses really look like. And then overall, like the big one is just that we want to avoid re-traumatizing these individuals again. That's really difficult to do in a detention facility, especially when noises are really loud, when people are kind of popping out of nowhere, when you're doing bed checks with like lights shining in their rooms. So there are definitely behaviors that we can change to avoid re-traumatizing youth. Because we want to get them out of that cycle of violence. We want to, we don't want to cause further harm to them. And so these are the principles of trauma-informed care, again, that SAMHSA has developed. And this is really kind of where the ideas for this project started. So we have safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, and cultural, historical, and gender issues. And these are applied across different areas, different settings. This can be done in schools, this can be done in homes. And I'm particularly interested in how do we implement these principles in juvenile detention facilities and the juvenile justice system at large. So we have these principles to kind of guide, okay, these are what we need to keep in mind. These are the things that we really need to focus on, right? We need to make sure that these youth feel safe. And that's really difficult to do when you remove them from their home and you put them in a short-term detention facility and they maybe don't know when they're going to come out. It's also really difficult to build trustworthiness because, these youth have been engaged in the justice system. They maybe have not had the best views of authority figures, whether that's their parents, their teachers, justice officials. So really working to kind of build that trustworthiness is going to be really difficult. Peer support, how do we kind of build up that peer support within the system among youth that are in the facility? And then the collaboration and mutuality part is really these comprehensive services, kind of relying on the healthcare system and the education system and making sure that we can really deliver the best services to these youth so that this short-term interruption in their life is not going to be super detrimental. And then this empowerment component I think is really interesting because the justice system is kind of all about taking away any voice and choice that individuals have. And so how can we give that back to them, right? We have decided we're going to lock them up and we are in charge of their food schedule, their workout schedule, their visitation schedule, all of the rules and regulations. How can we give that back to them? And then, of course, these cultural and gender issues are really important. A lot of the research that I do focuses on gender responsiveness and, as I mentioned, girls in the system. And so, of course, taking into consideration these gender issues, racial issues, considerations about individuals who are immigrants, those who are wards of the state, just kind of taking into account all these different identities that one can embody when they're in the system. And then I'll just really quickly go through. So these are some examples of evidence-based trauma-informed care programs. So these are, for the most part, they are just programs, right, that individuals will participate in once a week. They go to, they go to group, they kind of learn about these things, they are processing these things. Maybe they're doing yoga, they're getting some therapy, but it might not be as widespread. It might just be that this is where this 1 hour or 2 hours per week is where they're getting this trauma-informed care. And I'm really interested in how can we expand that to the entire detention facility and all of the practices. So we've seen a lot of calls for trauma-informed care within literature from practitioners, from researchers, but there's really not any clear guidance or evaluation, right? We even see policymakers and legislators that are saying we need to be trauma informed. We need to be trauma informed, but we don't really know, okay, what are the exact practices that we can put into place? What is this template that we can kind of give to facilities to say, this is what a trauma-informed care facility looks like, and decide, are you trauma-informed, are you not, and how can we improve? So just some quick implications of kind of understanding this cycle and kind of building these trauma-informed practices before I get into what our study is actually going to do, is disrupting the cycle of violence, right? This is really important for us to do. We need to, when youth come into the system, they've likely been exposed to violence, they've likely committed some acts of violence themselves, and if we can kind of understand and address a lot of the trauma that they've experienced in the past, maybe we can kind of knife off those experiences to further trauma and victimization, and potentially prevent them from harming others in response to their own trauma. It also reclaims this rehabilitative model. And so trauma-informed care is very much about rehabilitation. It's very much about let's address what's underneath, these behaviors. And it's not about being punitive. It's not about just incapacitating them. It's really about repairing the harm that's been done to them. And ideally, this could reduce juvenile offending. And so again, if we're disrupting the cycle of violence, they're committing less violent crimes, they're committing fewer crimes that are even just related to trauma, such as substance use, running away, all of those types of things that will bring youth into the system. So our project really just kind of takes a look at first of what does it look like currently, right? We can't really evaluate trauma-informed care practices if we don't know what is already out there. Are facilities taking this into their own hands? Are they really using the programs that are out there? Are they taking up these calls from policymakers? We don't really know, right? So our goal is that we're going to do a nationwide survey of detention facility employees. We're hoping to get about 150 responses from them, and then we're going to do some follow-up interviews to get a little bit more detailed responses from them about, okay, what does trauma-informed care actually look like in your facility? And I think what's going to be really interesting is not just getting information about the trauma-informed care practices that are currently happening, but maybe the lack of them as well, and kind of showing that there is this research practice gap and how we can fill that. So currently there are 620 facilities, youth juvenile detention facilities in the US. And so we're going to use the disproportionate weighted sampling, and then we're going to separate into different regions. So to get to this 310 facilities in our sample, there are about 10 states, so we're doing it by state first. There's about 10 states that have fewer than 5 juvenile detention facilities. And so we are just going to include all of those, those 1 to 5 facilities in our sample. And then for those that have 5 to 10, those states that have 5 to 10 facilities, we're going to take 5 of them, and then we'll do 20% of the remaining. So for some of them, this means they're going to have 6. For some of them, this means they're going to have 7 or 8. And then there are only 2 states, California and Texas, that have more than 10 facilities. And so we're still going to do the same thing. That'll end up being the 5 initially, and then at 20% on top of that. And so they might have a little bit more. They might have 10 or 11 sites that we sample from. So out of these 310 facilities that we are going to include in our sample, we are hoping that we'll get anywhere from a 40 to 65% response rate. This is pretty common for online web-based surveys with juvenile justice practitioners. So that gives us about 150 to 200 facilities. And this is about 25, a little bit more than 25% of all of the facilities in the United States. Our survey has 10 different sections, just kind of their general trauma-informed care practices, their leadership, if their leadership buys into it. We really hit hard on those 6 principles of trauma-informed care because, they were definitely developed with practices in mind, with this implementation in mind. And so I think that'll be really helpful in kind of getting some information about, are we really following these? Are they beneficial when we're coming up with actual program implementation? We ask about training for staff, screening and assessment, and some of the programming. So a lot of that is kind of asking, we have all of these trauma screening protocols. We have a lot of trauma-informed care programs. Are they actually being implemented? And if not, is there some other type of screening or assessment or program that we might not know about, that we might have not have done some evaluations on, that we could kind of include in future recommendations. And then we ask about trauma education for youth, and then some staff support, and this includes a measure of vicarious trauma for staff, and then some barriers to implementing trauma-informed care. And I think that that'll be really important, especially for those facilities that are not really doing great at implementing trauma-informed care, or that are just not implementing it at all. And then our final question is just, do they have any interest in participating in these follow-up interviews? So for those that do have interest in following up with these interviews, it's just in that final survey question, they can mark yes or no and provide their contact information that we will store only for purposes of interviewing them. And then we're going to kind of take this sample of those who decide that they want to participate in this interview and make sure that we have a good representation of stakeholders and sites. And so because we're asking kind of for any employee within the detention facility that has a good grasp on the practices that might be trauma-informed care at their facility, right? So this might be the detention facility manager, this might be caseworkers and line staff, because they are the ones who are interfacing with youth the most. This might be a therapist, it might be a substance use counselor. So we really want to make sure in these interviews that we are drawing from all of these different types of employees and stakeholders that we can interview. And then also making sure, right, we don't want to have 10 of our interviews be in California and then the rest are kind of spread out, like in Arizona and Massachusetts, and kind of having like one from every other state. We're trying to make sure that we get a representative sample geographically as well. So then we'll be doing 1-hour virtual interviews with each of these sites. And the interview, again, just has these 10 sections, and they're open-ended questions. A lot of them just really build off of that survey to try to get more into, okay, what do these practices actually look like, right? We have a lot of yes, no, and, do you disagree or agree with this for our survey? And really with this, we want to get into their mind. We want to have a conversation about, what do trauma-informed care practices look like in your facility. And then so once we have this all gathered, we have a couple plans to disseminate our project. One of them is a technical report to the sites that have engaged in this project, or that are interested, maybe that didn't participate in the project but are interested in it. That'll really just include our basic findings, and then some mostly just suggestions of how can you actually implement this in your own facility. What do these practices actually look like? What's working? What's not working? And then we'll have some longer reports that are submitted to justice agencies such as OJJDP, the National Center for Child Victimization and Trauma. We'll obviously be creating several, hopefully, manuscripts out of this to kind of disseminate to the larger research audience and academic audience in several journals. But we really want to make sure that this information is being distributed to detention facilities that can use this and implement it in their own sites. We plan to do some webinars as well that we'll invite sites to participate in, just kind of sharing our information in another format. And we'll also be creating a podcast episode to disseminate this to the wider public and hopefully educate them on, this kind of cycle of violence that brings youth into the system, and then what we can do about it to make some changes. So I will stop there and stop sharing my screen. And so first, if we just want to maybe discuss some of just the overall research project that I've been talking about. I have a couple just specific questions for discussion that we can also hit on. And then I'm going to email Jean the interview and survey protocol so that we can all look at that and kind of take a look at it and see if there's anything we can add.
Thank you, Nicole, for your presentation. As we'll have it open if people have questions or comments they want to talk about.
I was just going to say that this sounds really interesting, and as somebody who, especially when I was a social work intern and things like that, this is kind of a lot of the work I was doing was within the juvenile justice system. So I think the way that you're thinking about this is really important, especially when we think about who is in the system and how that whole process goes for them. So I'm really looking forward to what you find.
Awesome, thank you. Yeah, that's my goal with this, is any applied research that we can do that really helps out people that are working in the system. I think there's definitely that desire to want to implement these types of practices, but sometimes we don't have that clear guidance on what does this actually look like.
So I have a question for you. It sounds like most of this is in the planning phase and you haven't started conducting it yet. Was there any like pilot work that went into planning this, or so what are maybe some of the preliminary pieces that have happened before this to help you in designing and planning it?
Yeah, so a lot of it just for the planning process has been reading just about everything possible on trauma-informed care, and especially any evaluations or implementation reports that have been done. A lot of them are on more specific programs, and kind of seeing like, okay, what are the barriers that they're facing? What are some really important, what worked really well? And then, so currently we are finalizing the protocols for our survey and our interview, and then we are going to be piloting those really soon. We have our IRB almost ready to go, so it'll be submitted within the next couple weeks. But we've also done, so Valerie and Chris and I have also done a lot of work with juvenile justice facilities just in general, whether that's detention facilities, courts, just kind of juvenile justice broadly. And so kind of pulling from some of our own experiences and research into, okay, what are, struggles with implementation, kind of where should we start from? I think that this is a really like exploratory study just into what is out there, and where do we kind of need to go from there so that it really can be a trauma-informed juvenile justice system. And it looks like Jean sent those documents in a OneDrive. Thank you so much. If you want to take a look at those and kind of read over them, they're pretty finalized, but definitely any ideas that anyone might have. I also was kind of interested in maybe having a discussion while we're looking over those about just kind of more ideas about dissemination. We definitely want to help to fill this research practice gap. And so any kind of creative ways to disseminate this information and get this in the hands of the right people, we would definitely love to kind of have that discussion too. And I don't know if Chris or Valerie, if either of you want to comment kind of like the planning stages of this too. Oh yes, so Jean said the communitypsychology.com for dissemination. Yes, that's definitely on our list. I forgot to put it in the presentation, but it will be there. Thank you.
Yeah, I'll just add that so Nicole received some funding through SCRAW through the Public Policy Committee, one of the mini grants, to kind of start doing this work. So we'll also be kind of working with that group of folks kind of within SCRAW, in terms of, both kind of finalizing the study and the report, but also in thinking about dissemination, not only using this like the CJ interest group, but using the public policy group, as a resource around disseminating and getting this information into the hands of the folks that, really can make change. And the other thing that I kind of was thinking about as to kind of share as Nicole was going through kind of what the plans are for this project and the study, is thinking also about what future work might look like in terms of whether it's follow-up studies or some kind of more action-oriented work that really can also integrate the voices of youth. So maybe something that's more kind of like a participatory action research kind of framework in which we also can understand youth experiences, particularly in detention facilities. We're working right now on a project in Hamilton County, Ohio, looking at some experiences of girls who are detained and system involved. But I think kind of more broadly, kind of within this, it'll be important also to kind of consider youth as an important stakeholder, and have their voice, heard as well, in terms of their experiences, right? So stakeholders and agencies might have protocols or, their views on kind of what's happening in the facility, but we know that might not necessarily be aligned with youth experiences, kind of within detention and then kind of more broadly within the community. So that's all the other point that I kind of want to make, that that's not like an oversight necessarily on our end. I think it's kind of just within the scope of what we can do with the funding we have and the timeline we have, to kind of do this survey and some interviews. But I do think that, thinking about ways in which we can engage youth as well in the research process and dissemination process and make sure that their voice is centered, will also be important.
I'm curious if that's something that might come up in your interviews or already like in some of the conversations that you've had with some of the folks in corrections. I know this is a conversation I'm hearing a lot with, I work primarily with adults and adult facilities. So talking about trauma-informed care and trying to really implement that. And there does seem to be, at least the people I'm working with, that intentional effort of trying to have a collaborative conversation where those who are incarcerated or formerly incarcerated are also participating in that conversation. But I don't know if, I guess you probably don't know until you collect the data, but I'm wondering if any of those conversations are like already happening organically or not. It would be interesting to see.
Yeah, I definitely think it will come up. I think especially when we kind of ask about, what is this like, are you educating youth about trauma? That's kind of something that I've seen in just more, like in some documentaries about trauma-informed care and more like site-specific kind of reports, is that there is this kind of education piece and engaging youth in really what these practices look like and educating them, but then also, especially that like empowerment piece, like how are we getting youth to feel like, okay, you're in this system that really takes away a lot of power from you, but how can you maybe reclaim some of that, making decisions about different case options that you have, about different treatment options you have, who you want to be in the room with you for these different conversations. And so I'm really interested in kind of what the practitioners have to say. And then, yeah, as Valerie was saying, I would love to talk to youth and actually hear their experiences of, do you actually, do you feel like you're getting this, and maybe comparing that in facilities that are more trauma informed versus those that are not, and really how we can help youth, really feel less traumatized by the juvenile justice system. Well, I don't know if there's any other comments or questions we want to discuss. I will just say for those who haven't been able to attend, if they get the chance to look over those documents and maybe have any comments or questions or see this recording and want to reach out and email me, would love to talk with them via email or over the phone. We definitely want to get as many diverse perspectives as we can kind of going into this project.
And actually, to that note, I'm not sure, Jean, do you know, will the link that you put to the drive in the chat, will that show up on the recording, or will that be something that like I should email out to the group instead?
It won't show up on the recording.
Okay.
So you should email it out. And I had a question about those documents. Do you want them up there for a limited period of time? So
Yeah, maybe for like 72 hours, I feel like would be good. Just we're definitely, Valerie, if you have other comments, we're definitely trying to get it into IRB soon. So if there's any comments or anything like that, we'd love to get them really quickly. Here's my cat this morning.
So I'll get the video up as soon as I can, and then Candlin, why don't we say that the documents will be up through like Sunday?
Okay.
Okay.
Yeah. Yeah, so I will just email out the video to everyone with that link and let them know about that.
Yeah, that sounds good.
Excellent. Well, thank you so much, Nicole, for your presentation, and to